Many people are searching for the fact that whether Siddha medicines can cure coronavirus. So we decided to do a video on this. See, the first coronavirus was reported on 31st January 2020 in India, in Thrissur, Kerala. From that day till now, there has been more than 1,000 cases and more than 30 deaths. The methods which can prevent this virus is social distancing, hand washing. We all know that. Also, there is no allopathic treatment or no vaccine till date. So this is all the things we know till now. In this time, we don't want to claim that this medicine is good or that medicine is good, this medicine can treat corona. Why? Because a single Ayush doctor or any Ayush doctor has not treated coronavirus till date. But it doesn't mean that we are not doing our part. Every Ayush doctor is doing research daily on the pattern of the virus, and they are creating their own treatment protocol. Many papers have already been submitted to the health authorities. Even our PM and state governments have contacted the Ayush doctors, and they are planning and they are putting forward for a preventive or preventive measures during quarantine. And many have already submitted the protocol to the state governments also. But here we should understand that we all are working under a closed system. Right now, we cannot reveal any information and we cannot claim that this medicine can cure coronavirus. If we are doing such thing, it is actually a misinformation which we are providing to you. During the discussions, both the Siddha and Ayurveda doctors have laid stress on preventive measures during quarantine. Many people may think that when there is only social distancing and hand washing techniques, then why we are stressing on preventive measures? If you look into the coronavirus disease, pandemic, this disease manifests in two ways. In some people, it just comes and goes as a flu symptom, very mild symptoms, and in some people, it may even lead to pneumonia and kidney complications. So only if you are immune, the antibodies in your body can eliminate the virus better. This is what we all are stressing in. This preventive measures is not only directed by Siddha or Ayurveda doctors, but even allopathic doctors are now suggesting their patients. Many doctors are giving vitamin C to their patients. Even AIMS doctor, Dr. Pradeep Seth, has directed vitamin C tablets 500 mg twice a day. Some doctors also prescribe vitamin D and zinc supplements. And I talked to one of the doctors abroad who said that they are also giving flu shots to their patients just to distinguish between flu and coronavirus. So it is not that only Ayurveda and Siddha is stressing on preventive aspects, but also modern doctors are supporting in the preventive measures. In many parts of Kerala and Tamil Nadu, Siddha medicines are proposed to be given. Some parts of Tamil Nadu, it has already started. There is a medicine called Kabazura Kudineer, which is formulated, which is a polyherbal combination of 15 drugs, and which is given as a prevention. Please note, it's not a treatment, but it is given as a prevention, because doctors of Siddha believe that they are actually a combination of drugs which is immunomodulatory as well as prevent respiratory symptoms in patient. These drugs are febrifuge. All the drugs in Kabazura Kudineer is defined as febrifuge. And these medicines are actually not prepared or not formulated now. It is time tested. These have been prepared, like it has been mentioned in the classical text, and the same formula is actually used now. And still for many ailments, like previously when there was a swine flu outbreak, this medicine was also used and it was very helpful. There is another medicine called Nilavimba Kudineer, which is very popular these days. Once before, it was talked about a lot during the dengue outbreak in 2017 as well as the chikungunya outbreak. Those times these medicines were also tested in International Biotechnology and Genetic Center, New Delhi, and it was found both immunomodulatory as well as antiviral. So doctors are proposing this medicine, but things are yet to be confirmed whether it is a cure or preventive against the ailment. Unlike Ayurveda, Siddha medicine kashayams are a bit different. We get it in form of a powder. Like all the herbs are powdered, crushed and powdered in a crude form, and you have to prepare the decoction as instructed and take it. Not like the ones you get in bottles. It is very different. Siddha medicines are different, a little bit different from the Ayurveda medicines. Another Siddha drug called Eucorice or Adimadhuram was very popular during the SARS infection in 2002. Actually, during the researches, it was found that the phytochemicals present in this herb was found to be and showed antiviral activity against the SARS coronavirus. This is also a part of Siddha polyherbal decoction, Adatode Kudinit, which we use to treat asthma patients, and we also use this herb to treat retroviral ailment like HIV. All the Siddha medicines are classical Siddha preparations and not formed or formulated just today or yesterday. It was mentioned in the literatures like for ages. We all know that novel coronavirus pandemic has created havoc all across the globe. But at the same time, I believe that when we are looking, we all look for higher and bigger things in life, but sometimes the solution lies in simple and smaller things. Hope our health authorities make use of our Indian system of medicines also effectively to deal this pandemic. So far, there is no update on Siddha cure against the novel coronavirus. We'll keep you updating with the right news time to time. Stay tuned, take care, God bless, and Jai Hind.